The U.S. Department of Health and Human Services recently announced a series of actions aimed at banning gender-affirming care for minors. And that's the topic of this week's Healthcare Triage. Gender-affirming care for youth refers to a range of developmentally appropriate medical, psychological, and social supports designed to help children and adolescents whose gender identity differs from the sex they were assigned at birth. It is individualized, evidence-based, and delivered by multidisciplinary health professionals, often involving pediatric clinicians, mental health providers, and families working together over time. For many young people, gender-affirming care begins with non-medical steps such as counseling and family support. For adolescents who experience persistent gender dysphoria, medical options like puberty blockers or gender-affirming hormones may be considered following careful assessment, informed consent, and ongoing monitoring. Allowing access to this type of care should be a health, not a political, debate. Decisions made about it should be made between healthcare professionals and their patients and should be evidence-based. So what does the evidence say? To the research! A substantial body of research shows that transgender and non-binary youth face higher rates of depression, anxiety, and suicidal thoughts than their peers. And, contrary to some claims, these symptoms aren't inherent to being transgender, but are strongly linked to external factors such as stigma, discrimination, rejection, and lack of access to appropriate health care. Mental health outcomes are closely tied to whether young people feel supported and affirmed in their identities, particularly by caregivers, clinicians, and institutions. Studies examining gender-affirming care consistently find associations with improved mental health outcomes. Research published in the Journal of Adolescent Health found that youth who had access to gender-affirming hormones reported lower rates of depression and suicidality compared to those who wanted but could not access this care. Further studies have similarly shown reductions in depressive symptoms, emotional distress, and suicidality among adolescents receiving puberty blockers or hormone therapy. Other research indicates improvements in psychosocial functioning, life satisfaction, and overall well-being following the initiation of gender-affirming medical care when clinically indicated. Importantly, these interventions are not provided in isolation. Mental health evaluation and ongoing psychological support are core components of gender-affirming care models, particularly for youth. Puberty blockers, for example, have a long history of use in pediatric care for other indications and are considered fully reversible in the context of gender dysphoria. Their clinical purpose is to pause pubertal development, giving adolescents time to explore their identity without potential stress associated with unwanted physical changes. For some youth, this pause alone can significantly reduce anxiety and dysphoria. Banning access to gender-affirming care removes a key protective factor for a population already facing elevated vulnerability. Youth who are denied desired care may experience worsening distress, increased feelings of hopelessness, and disengagement from healthcare systems altogether. Studies of transgender adults show that those who are able to access gender-affirming care earlier in life report better mental health outcomes than those who were unable to do so, suggesting that delayed or denied care can have lasting consequences. Bans on gender-affirming care may also disrupt the relationship between families and clinicians, limit evidence-based medical decision-making, and force youth to navigate puberty without support for distressing physical changes. Research consistently emphasizes that lack of affirmation and exposure to rejection are major contributors to poor mental health outcomes among transgender individuals, and removing access to care may only intensify them. Major medical organizations recognize gender-affirming care as a standard part of appropriate treatment for transgender and non-binary youth when clinically indicated. Such care emphasizes individualized assessment, parental involvement when appropriate, and careful weighing of risks and benefits. Taken together, the evidence shows that gender-affirming care is not about encouraging any particular identity, but about supporting the health and well-being of young people as they navigate development. Research indicates that when transgender and non-binary youth are affirmed, supported, and able to access appropriate care, their mental health outcomes improve. When care is restricted or banned, existing disparities remain unaddressed and in many cases are made worse. Hey, did you enjoy this episode? You might enjoy this previous episode on government data disappearing down the memory hole. We'd really like it if you'd like the video, subscribe to the channel down below. Consider going to patreon.com/healthcaretriage where you can help support the show, make it bigger and better. We'd especially like to thank our research associates, Joshua Crow, Edward Liljeholm, and Christopher Learn, and of course, our Surgeon Admiral, Sam.